Are you peeing while jumping on that trampoline? Or hoping you don't leak in the grocery store line when you cough or sneeze and forgot that pad? Or maybe you come back completely wet after a run? You may have stress incontinence. Or are you that person that's peeing maybe 15 to 20 times per day or leaking right before you sit down on the toilet? You might have urge incontinence. Or you're that person who tried to fix the stress incontinence by going to the bathroom all the time, and now you have both. First off, don't stress. 30 to 35% of women end up having this after having a child. I'm gonna tell you a true story. I was working with a patient, and for the background, I've had both urinary and rectal incontinence. So I was working with this patient, and I had to use the restroom. I was like, it's fine. And in that hour, the patient goes, you sat on something, and she brushed my bum. I was like, what did I sit on? Like, what is it? Didn't know what it was. She ended up leaving. I went to the restroom, I sat down, and I realized I had pooped my pants. And the reason why I'm telling this story is because sometimes, even if you're a pelvic floor therapist, you don't always know when it's gonna happen or if it happens. It just kind of happens. I want to talk about some easy things you can do to fix this. Often if people seek pelvic floor therapy in the first year, they get better. First thing first is we'll look at your diet and how this is impacting it. If you have too much acidity and you're eating too many limes, lemons, tomatoes, grapefruits, oranges, it creates too much acidity and can cause an irritant to the bladder. Or if you're having too much tea, caffeine, coffee, or alcohol, that can also create an irritant. So easy fix is just stop those things for a week or two and see if your symptoms get better. If not, we should start looking at the pelvic floor strengthening and how to tighten all those muscles back up. First off, you might be wondering, what is the pelvic floor? It is a group of muscles down here, and it controls bowel, bladder, and sex. And after having a child, everything kind of becomes lengthened and overstretched out, and so it's hard for people to engage it back up, and that's what causes the incontinence. So I'm gonna have you kind of follow along with me in how we do this. So a lot of times people think, okay, do a Kegel, squeeze, relax. And oftentimes when I'm putting my finger into them vaginally, they have no idea what they're doing. It's almost like that cord has been cut, and so they just are doing silent. Or a lot of times they can do the squeeze, relax, but they can't do any of the other muscle groups. So what I'm gonna have you do out there, and if you're 6 weeks postpartum, you can even put your finger inside there and actually feel to see if you're gripping around your finger or not, and if it's engaging the way I'd be checking a patient. So I'm gonna have you kind of quick up, squeeze, and then slow, relax down. Did you lose it? A lot of people drop it on that way down. The next exercise I call the mountain, where I have them slowly 1, 2, 3 up, and then 1, 2, 3 down. Again, a lot of people end up losing it on the down. Then I have them try to squeeze and hold around my finger. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Did you lose it? Most of my patients can only hold 3 to 10 seconds. Eventually, with pelvic floor therapy, I try to get them up to all the way to 60 seconds. And that allows them to be able to go to an exercise class or hold and transition to be able to do activities without leaking. The last exercise I call it the elevator. Right now we're at the basement, there's no contraction. You go up to level 1, and you go up to 50% of your max contraction. You hold. Go up to level 2, 100%, hold. Back to 50, hold, and then relax. I take those 5 different exercises, and then I teach them how to do it laying down and sitting, standing one leg, bent over a table. Then I have them on a Bosu ball. I have them jump 50 different times. I like to use something called a biofeedback machine, which I describe it's like Etch-a-Sketch of your vagina. And you insert this probe inside of you, then you put your pants and underwear back on, and then they can do it in each of those positions while drawing pictures. This works great for me. Some pelvic floor therapists don't like using it, and they end up using more internal work too, which seems to work for them as well. The important key with each of these exercises is they should not be painful. If they are painful to do, it's possible that you're actually too tight versus too weak, and that ends up being your problem. I'm really hoping that this will be helpful to kind of get you going. It'd be great if we all stopped peeing our pants after having a baby. Oh, one thing, the incontinence hotline called, and they said, please hold. That's it.